Hi, my name is Jackie McRae and I'm the Chief Investigator of the DAISY Project. The DAISY Project is an NIHR study that aims to improve the way we identify dysphagia in acute cervical spinal cord injury patients. If you're watching this video, you're wanting to find out more about the Swallow screening tool. The tool has been developed following a series of studies and an expert consensus that has helped to identify the key risks that may develop into dysphagia for these patients. I'm now going to talk you through components of the Swallow screening tool. The DAISY Swallow screening tool is made up of 12 components divided into 3 sections called injury risk, clinical risk and urgency. The tool doesn't require you to do anything to the patient or any scoring, just to tick off the clinical issues that are present. You will need to find out about some clinical aspects in advance, and it may be helpful to do this as a team. Starting with injury risk, does the patient have a brain injury or cognitive deficit following their injury? Is their injury at the cervical level of C1 to C7? Is the injury complete or incomplete, which relates to the diagnosis according to the American Spinal Injury Association? Has the patient had anterior or posterior cervical spinal surgery following this injury? Next is the section called clinical risk. Does the patient have a tracheostomy, whether cuffed or uncuffed? Has the patient required intubation of 48 hours or more? Does the patient require ventilation of any amount? And is the patient's nutritional intake reduced? If there are positive signs of risk in each of these sections, a referral to the Speech and Language Therapy Service should be considered for further diagnostic testing. The next section is entitled Urgency and includes the presence of a recent chest infection, spiking pyrexia, an increased need for oral care, and an increased need for suction. These indicate the development of symptoms and a change of clinical management is suggested, in addition to referral to speech and language therapy. As you can see, the DAISY Swallow screening tool doesn't take long to do, and I hope it will help staff to better identify the risks of dysphagia and enable earlier intervention. Please send me your comments through the website at www.daisyproject.info. Thank you and good luck.